know the subject you're dealing with, and if you've got very up-to-date information and you're on top of the topic, it does make it much more satisfying to practice as well.
So BEST actually stands for Best Evidence Summaries of Topics in Mental Health. And the idea is that if a clinician or a service user or someone who's developing services for service users wants to know what the best evidence is in a particular area, they can send us a question and we'll answer it within 10 days. And we'll make sure that the evidence that they get is of the highest quality. So that means using randomised controlled trials, which are very carefully controlled studies to look at the effectiveness or whether things work. Or systematic reviews, and systematic reviews might happen when you have a number of controlled trials and you want to draw the results from those trials together to provide a summary of the up-to-date knowledge in that area.
Somebody mentioned BEST a while ago, and I thought they were having me on because it just sounded a bit too good to be true. That you actually put in a question about research or guidance of how to treat particular conditions, and then somebody else will go away and search through all the literature for you and find out all the up-to-date information and send you back a little bundle of exactly what is the up-to-date thinking, because that's what we'd all want but we never have the time to do. And I was actually on a course and they were talking about research and development, and somebody from BEST gave a talk about it, and it was true, it was real that they did do this, and so I thought I'd give it a try to see if it actually worked. So I sent her the question. It's just a matter of going on the intranet, finding the best link, and then filling in a little form about what question I needed answering, what kind of time frame I needed the answer in, that kind of thing, and sent it off. And a few days later, a little email arrived with all the information I'd asked for. So I sent an email back to the person who'd done it. Said it was just before Christmas, saying it was just like a little Christmas present had landed in my email box because it just told me what I needed to know. So I found it brilliant, and I've now got a list of things I need to get in touch with BEST about. I'm just doing them one by one.
Anybody that works for AWP at the moment, from consultants to healthcare assistants, physiotherapists, occupational therapists, nurses, psychotherapists, and we also get questions from clinical leads or service leads. We've had a few questions from commissioners about service design, but we're hoping to open the service up at some point to service users and carers so that they can ask questions about their care they receive or their loved ones receive.
I think it's been very well received actually. Certainly when we send out questionnaires asking people if they liked it, if they would use it again, if they found it helpful, the replies are quite positive. We've had about 300 questions over 2 years, and although maybe a quarter of those don't have any high quality evidence, the other questions have all resulted in answers which people clearly find useful, because we can track on the website whether people have come back to view those answers. So in fact, most of the traffic on our website is people looking at answers that have already been produced. Because of those 300 questions, you can imagine that quite a few of them are the relevant questions for people working in mental health services today.
So BEST helped me when I was working with a service user who was involved in a child protection child protection need. And I was working with children and family social workers, and there was a really strong emphasis on doing oral drug screens. And I was working with a service user who was saying that what the drug screens were saying and what she was taking was completely different. So my own kind of experience of working with service users is actually there is sometimes a disparity between drug screens and what people say. And I was also quite aware that in terms of the evidence around what drug screens are the best, so be it an oral mouth swab or a urine screen or a hair strand test, that the evidence is is fairly poor. So I used Best to support me with this, to support the service user, to inform the social workers, but then also to inform quite a key clinical decision regarding A, the treatment for this service user, but also longer, looking at the wider impact, whether or not this service user would keep her children or not. So it was really key. And what Best gave me was the evidence to support the decision-making process.
So we started out with the idea that it would be useful for clinicians who had particular questions about service users they were working with, where the evidence might not be easily accessible. And then of course it became very clear that if you were developing a new service, you should know what the evidence was for developing the new service. And then to move it on a stage further than that, you might be wanting commissioners to know what the evidence was so that they could commission services sensibly. But one of our goals over the last year or so has been to open it up to service users, because we would like service users to have access to exactly the same evidence that commissioners and clinicians have to help with the quality improvement of their care. And just because we think that it's right that everybody should have access to the same information. The challenge of that is that we need to work with service users to develop procedures for helping them to use the website and to put their questions in, to make sure that we know that clinicians need a lot of support, but we believe service users will need support to use that as well.
Easily go wider than mental health. It could go into all sorts of fields. GPs especially, I could see really making use of this kind of thing, because they are expected to know so much about so many different conditions, and again they have so little time to actually do that research. And it helps keep your enthusiasm levels up as well, because if you know the subject you're dealing with, and if you've got very up-to-date information and you're on top of the topic, it does make it much more satisfying to practice as well.